Alright team, we have a patient presenting with periodontal disease, multi-system inflammatory syndrome in children, and periodic fever syndrome.
What do you think is the diagnosis?
It could be a number of things with those symptoms. Maybe an autoimmune disorder or an infectious disease.
I'm leaning towards an inflammatory condition, possibly a result of an underlying infection.
Could it be related to a genetic disorder? Those symptoms are quite broad.
No, it's Sandhoff disease. The treatment is diffusing alpha emitters radiation therapy. It's risky, but it's our best shot at saving this patient's life.
Are you sure, Hawks? That therapy is highly experimental and dangerous.
I've read about cases where patients didn't make it through that treatment.
Is there any other option, Hawks? I don't want to risk the patient's life unnecessarily.
Damn it, we don't have time to second guess. This is our only chance to make a difference in this patient's outcome. We have to proceed with diffusing alpha emitters radiation therapy now. Tracy, I need to discuss the options for treating my patient with you.
Sure, Hawks. What treatment are you considering?
I believe diffusing alpha emitters radiation therapy is the best course of action for the patient with Sandhoff disease.
Hawks, are you sure about this? Have you considered all the risks and alternatives?
Tracy, I have years of experience in this field. I know what I'm doing.
I understand that, but we have to be cautious with such treatments. Let's discuss this further before making a decision.
I can't believe you're questioning my expertise on this, Tracy. I know what's best for my patient.
Hawks, I'm not questioning your expertise. I just want to make sure we're making the right choice for the patient's well-being.
Fine. Let's discuss it further. But trust me, diffusing alpha emitters radiation therapy is the way to go.
Oh no, this is not good. The patient is in critical condition. I need to inform Hawks immediately. To himself, I can't believe this.
The diffusing alpha emitters radiation therapy was definitely not the right treatment. How do I break this to Hawks without causing panic?
What in the world were you all thinking? Using the wrong diffusing alpha emitters radiation therapy could have killed our patient.
But Dr. Hawks, we thought the symptoms indicated a different diagnosis and treatment.
You thought wrong, Gary? You were supposed to verify your findings before proceeding with a dangerous therapy like that. And, Kelly, how could you have missed the crucial signs pointing to the correct diagnosis?
I'm sorry, Dr. Hawks. I made a mistake.
A mistake. This is a matter of life and death. And Frank, don't even get me started on you. You were supposed to double-check everything before it went wrong.
I'll do better next time, Dr. Hawks.
You all better do better next time, or I swear I'll personally make sure you never work in this field again. Now let's debate this diagnosis, since you clearly couldn't get it right the first time. I can't believe I still can't figure out what's wrong with this patient.
Maybe you should consider checking for a possible allergic reaction or a rare genetic disorder.
I already thought about those, but it doesn't quite fit the symptoms.
What about a vitamin deficiency or a hormonal imbalance?
That could be it. Thanks for the suggestions, Johnson.
No problem, Hawks. Let me know if you need more ideas.
Wait a minute. I know what's wrong. I'll be right back. Leaves abruptly without saying goodbye.
Well, I guess I'll just finish my lunch alone then.
I have an important announcement to make.
Shit. Hawks, we are in the middle of surgery. Where's your safety gear?
This is highly unprofessional, Hawks. You can't just barge in like this.
I can't believe this. Hawks, you need to leave immediately.
Listen, I've made a new diagnosis. It's familial isolated vitamin E deficiency. Tracy, I finally figured it out. The patient has a rare condition that we need to address immediately.
That's great news, Hawks. I'm glad you were able to find the right diagnosis.
It wouldn't have taken this long if you had just listened to me from the beginning.
Hawks, the wrong diagnosis could have cost the patient their life. You need to trust me as your superior.
Trust you. You were the one who led us down the wrong path in the first place.
I made a mistake, but we can't dwell on that now. Our focus should be on saving the patient.
I can't believe you're still trying to defend your actions. If you had only listened to me, we wouldn't be in this mess.